very excited to be presenting abstract 530, which is real-world outcomes with axicabtagene ciloleucel, or axi-cel, for the treatment of large B-cell lymphoma. We know axi-cel is an autologous anti-CD19 CAR T-cell therapy. It's approved for use in the third or later line treatment of large B-cell lymphoma. And that's based upon the ZUMA-1 clinical trial, the pivotal ZUMA-1 trial that led to those approvals. Now, we know in the real-world setting, patients are being treated with axi-cel who have comorbidities that would have made them ineligible for treatment on ZUMA-1. And in fact, real-world safety and efficacy results of axi-cel are out, and it suggests that those patients can still benefit from axi-cel, although the response rates and duration of response are more advantageous for patients who would have been eligible for ZUMA-1. So here in this study, we interrogated the axi-cel post-approval safety study, which is being conducted by the CIBMTR to assess the impact of age and comorbidities in the real-world setting. And in this study, 1,500 patients were enrolled, and here we're presenting data on 1,343 patients. And these were the patients that had at least 180 days follow-up. Importantly, 38% of these patients were 65 years of age or older. A small percentage, 4%, had an ECOG performance status of 2 or greater. But overall, 51% of the patients would not have been eligible for ZUMA-1, either because of elevated performance status or some comorbidity or CNS lymphoma being present. And so over half the patients in the real world are being treated who would not have been eligible for the pivotal ZUMA-1 study. When we look at the objective response rate in these patients, 73.6% had a response, and 56% of patients had a complete response. So very comparable to the pivotal ZUMA-1 data. And then with a median follow-up of 13 months, median progression-free survival was 8.8 months, median overall survival was 22.4 months. So despite these patients having comorbidities and not over half not have been eligible for the ZUMA-1 trial, we're seeing similar progression-free survival and overall survival rates, which is very important. When we look at the toxicity, cytokine release syndrome was seen in over 80% of patients, but grade 3 or higher severe cytokine release syndrome was seen in 8% of patients. Similarly, neurotoxicity or ICANS reported in 55% of patients, with grade 3 or higher ICANS in 25% of patients. Now, when we looked at outcomes by some of the variables, advanced age greater than or equal to 65 didn't impact efficacy outcomes. Patients had similar efficacy outcomes, actually perhaps better efficacy outcomes. However, older patients had higher rates of CRS and ICANS. Patients with coexistent organ dysfunction had generally favorable outcomes with axi-cel, but the presence of moderate to severe hepatic, renal, and cardiac diseases were associated with lower overall survival. And so it's an important study with a huge number of patients confirming that axi-cel can really have great efficacy outcomes in patients with relapsed refractory large B-cell lymphoma.